So in the next slide, we're going to discuss the other drug that has also been approved, low-dose cytarabine with glastigib, also a novel pathway, hedgehog pathway inhibition, which has been used in many solid tumors. In heme, this is the first drug to be approved in that indication. As Dr. McCloskey was discussing, we also were part of this trial, participated in it. And actually, the tolerability of this agent is quite good. And I think this could be an agent that will be built on further, building on the combinations that are already being used. The study was a randomized study. It was a 2:1 randomization. And you see that the overall response rates, not as high as we see with the HMA-VEN, but definitely better than low-dose cytarabine alone, about 22-23% as compared to 5%. So definitely a meaningful option, especially in, let's say, very old patients where I may be concerned about even aza-ven. If you have an 85-year-old who's very fragile, those are the people where single-agent oral IDH inhibitor or low-dose glastigib could be something to consider because they're actually very well tolerated. And the survival data, as is shown in this next slide, was met, 9 months versus 5 months, and this did lead appropriately to the FDA approval of this agent. And of course, this agent is being evaluated now in multiple phase 3 studies. One of them is with 3+7, which I think would be very interesting because other than midostaurin, which is approved there, and gemtuzumab maybe for the favorable risk, that is still an open space. So if the glastigib addition shows a benefit in those non-FLT3 non-core binding, that could actually be an open area. And it's also being looked at with AZA, but a lot of that is outside the US because here aza-ven has become one of the things used very frequently. The last slide is looking at gemtuzumab. We kind of briefly discussed this. I think our practice at MD Anderson has been the same as what Dr. Rizzieri mentioned. We do use this for all our core binding factor patients across the board, and we are very happy with the benefits seen. The MRC has published on this, the Alpha Group has published, we've published on it. There is a single agent gemtuzumab frontline approval, believe it or not. This is even less discussed than the glastigib. Again, you're talking about 5 months versus 2.5 months. Very hard to see what patient would fit in this. I've personally never done it or seen it being done in our center, but it's out there. But I think the big use is with core binding factor and potentially in relapse. And the good thing is at the 3 per meter square fractionated doses, the VOD incidence is very, very low, and we actually have not seen it so far. So hopefully that will continue. And with that, I will stop our discussion here. Anybody else has any thoughts or important things to mention? Anything else?
Great discussion.
Great discussion. Well, thank you all very much. I think this was a very nice panel, and thank you all. With this, I will specifically thank Dr. McCloskey, Dr. Rizzieri, Dr. Weinberg, Dr. Gergis, and I agree it was a very, very good discussion. And for all of us in the audience who are listening to this and sat through 1.5 hours of this very enthralling AML discussion, thank you all very much.